When you have cataract, one of the things that I get asked often when you are referred in to discuss cataract surgery is, will you be putting a lens in my eye? And the answer is yes. When we do cataract surgery, what we are doing is removing your natural lens, which has become cloudy, and we have to replace it with something. So we're going to replace it with a clear lens that you will have for the rest of your life. There are many different kinds of lenses that we can place in your eye, and ultimately it's our decision together to decide what's best for you. Standard lenses are typically what insurance will cover. A standard lens is something called a monofocal. So a monofocal lens means it will correct for one focal point, which is typically far vision or up close. And when we're talking about cataract surgery, we have the option to choose how to correct your vision. Most people will say, I don't want to wear glasses most of the time, but I'm okay putting on reading glasses. And that's where a monofocal standard lens is excellent, because your vision most of the time will be great out of glasses, but when you're reading really up close, you're going to have to put on reading glasses. I definitely have patients that prefer to read without glasses. I have a jeweler actually that comes in and he wanted to be able to look at everything without glasses. He wanted me to correct his vision for here, which we did, and then the rest of the time he has to wear glasses. So that's what we're talking about when we talk about standard lenses. There are more advanced lens options that give us the opportunity to try to correct your vision even more so that you don't have to wear glasses. Let's say you have something called an astigmatism. Pretty much everyone has an astigmatism. It just depends what level it is. And what that is instead of your eye being perfectly round like a globe, it's more football shaped. And it just has to do with the way that your eye developed. It's nothing that you did. If people have an astigmatism of a certain level, during surgery, we want to try to correct it with a special lens, which is called a toric lens. What's amazing about this lens is we implant it in the eye, and it helps to compensate for the change in shape of the front of the eye so that when light hits the lens, overall your vision is better. Reasons why a person should choose a toric lens if they have a very high astigmatism is that it gives you very high chance of not needing glasses most of the time, but you probably still need reading glasses. If you have a high astigmatism and you do not have a toric lens, we will put in a standard lens, but the shape of the eye has not been taken care of. So you will still need glasses all of the time. So that's really the main difference. We also have lenses that allow us to correct for multiple depths of focus. So that means that potentially you wouldn't have to wear glasses most of the time. So they correct for distance, computer, and up close. They're called multifocal lenses. That's because they're correcting for multiple depths of focus. Multifocals are amazing. They've been around for years. The models that we use in our office are the most advanced. People do really, really well with multifocals. Sometimes you'll hear things like, oh, I had a multifocal placed and now I see halo and rings when I'm driving at night. It's definitely something that some patients will experience. Typically it goes away within a few months, but that just has to do with the way that the lens is designed. It actually has rings in the lens, which helps to focus to allow you to see at different visions.